We want to turn back to the top story, the dangerous air quality in the eastern part of the country. Dr. Leonardo Trasande is on the phone. He's a professor in pediatrics, environmental medicine, and population health at NYU. Doctor, help us understand just how bad this is and what could the impact be on our health?
Well, the warming climate has increased the number of fires in the north, and that, together with wind, has brought soot or fine particulate matter. These particles contain carbon-based compounds and metals that irritate the lungs and enter the bloodstream. And in the bloodstream, they cause inflammation that can also contribute to heart attacks and even stroke. So these are serious consequences that can arise when you inhale, particularly this toxic air.
And in terms of the scale of how bad it can be, it's about as bad as it can be in New York City right now. Is that right?
The levels have reached the unsafe to breathe for the general population. Yes, at first we were dealing with just vulnerable populations that were at risk, but this is equivalent to smoking multiple cigarettes in a given day.
And for those vulnerable populations, people with health conditions like asthma, what extra precautions should they take? And also, what about kids?
Well, there are, fortunately, some steps that people can take to limit their exposure. And I would suggest at this point wearing a mask. In particular, a surgical mask is okay. Ideally, an N95 mask would be even better for filtering out these particles so that they don't get into your lungs in the first place. It's important to have as good a filtration system for air indoors. The preference would be for HEPA filters, but there are a variety of setups that one can use to facilitate the filtration of air that are less expensive than HEPA-based filters. And at the very least, air conditioners with the function of simply recirculating the indoor air can go one step towards reducing the amount of air pollution that enters indoors. And
how should we think, Doctor, about this ending? In other words, are there long-term risks? Should those of us who are exposed to it taper up our behavior, even if the all clear in the air gets better?
We know that air pollution contributes substantially to premature births. We know that children exposed to air pollution, particulate matter and ozone, can develop or even have worsening asthma as a result. And then there are long-term consequences for lung function, such that children who are exposed early in life are more likely to then develop chronic obstructive pulmonary disease. So there are serious long-term consequences to air pollution exposure, even in relatively short periods of time.
Dr. Leonardo Trasande, thank you with NYU. Thank you so much.